Thank you for watching the Shikama Live Show with your host, Shikama. President Obama's choice to top the health official at the Veterans Affairs Department withdrew his nomination Thursday, saying he feared his confirmation could spark a prolonged political battle. Jeffrey Murawsky, healthcare chief of the VA's Chicago-based regional office, was nominated last month to be the department's new undersecretary for health care, replacing Robert Petzel, who resigned under pressure, which is actually not true. He was going to resign anyway. Petzel had been scheduled to retire later this year, but was asked to leave early amid a firestorm over delays in patient care and preventable deaths at veterans hospitals. Murawsky now oversees 7 VA hospitals and 30 clinics in Illinois, Indiana, Wisconsin, and Michigan, including one in suburban Chicago, where there are allegations that its staff use secret lists to conceal long patients' wait times for appointments. Murawsky was a doctor at the Hines, Illinois hospital and technically remains on staff. The White House said in a statement that Murawsky feared a prolonged fight over his confirmation, adding that he believes the role is too important not to be filled quickly. Obama accepted Murawsky's withdrawal and will move quickly to find a replacement, the White House statement said. The VA is required by law to convene a commission to seek and review candidates for the position, which oversees the 9 Veterans Health Administration, the largest single health provider in the nation with 9 million patients, 150 hospitals, and 820 walk-in clinics. Robert Jesse, Petzel's chief deputy, has served as acting undersecretary since Petzel resigned May 16. Meanwhile, acting VA Secretary Sloan Gibson was making a visit Thursday to the Phoenix VA Medical Center, where reports about veterans dying while waiting appointments set off the furor, resulting in retired General Eric Shinseki's resignation last week after holding the top VA job in Obama's cabinet the past 5 years. An interim inspector general's report last month said veterans in Phoenix wait an average 115 days for a first appointment, 5 times longer than the 24-day average the hospital had reported. The inspector generals said more than VA facilities nationwide were under investigation. The VA said in a statement Thursday that officials appreciate Murawsky's service to veterans and respect his request to withdraw his nomination. Murawsky's withdrawal comes as the Senate moves forward on a compromise bill to help veterans avoid long wait times to see a doctor and make it easier to fire administrators who falsify records, cover up long wait times. Hopes for a vote this week were dashed, but senators said they would press ahead in a measure to address an uproar over veterans' health care following allegations that veterans have died while waiting to see a Veterans Affairs doctor. Senators had wanted to pass the bill before Friday's 70th anniversary of the Allied invasion of Europe in World War II. As many as a dozen senators were expected to attend the D-Day ceremony in France. Senator Bernie Sanders of Vermont, chairman of the Senate Veterans Affairs Committee, had said Wednesday he was cautiously optimistic that a vote could be held Thursday. Sanders and Republican Senator John McCain of Arizona were leading negotiations on the bill, holding 2 closed-door meetings Wednesday to iron out details. The senators met again Thursday. The main stumbling block appeared to be when and under which circumstances veterans could turn to doctors and other providers outside the 1,700 facility VA system for what is largely free care for them. The 2 lead negotiators couldn't agree on how to define it. Sanders said the primary issue was waiting times, while McCain said it was giving veterans a choice beyond the VA for receiving care. A bill sponsored by Sanders would allow veterans who can't get timely appointments with VA doctors to go to community health centers, military hospitals, or private doctors. McCain would rather let veterans who can't get a VA appointment within 30 days or who live more than 40 miles from a VA hospital clinic go to a doctor who participates in Medicare or the military's TRICARE program. This is what Obama was trying to avoid with that Bergdahl prisoner swap. This fiasco is leading to impeachment anyway, but Bergdahl is also leading to impeachment. So I don't know who thought that that would be a great distraction. They literally pulled it out of their butt. Very last second, laws were broken. You know, they're supposed to get a 30-day notice to Congress, and Congress has to have some sort of input on a prisoner swap, and they went over their heads. They also went over the intelligence community's heads and did the swap without conferring with anybody. This VA scandal is rocking the administration, and they can't squirm out from under. For whatever reason, they're able to squirm out from under Benghazi, or it's taken so long. I don't know what the deal is with that. And yes, that has an inkling of possible jail time or even a verdict of they could actually prosecute the president for that. But they are dragging their feet. And everybody's saying they can't prosecute the first black president. That is not holding water with the VA stuff and with Bergdahl. Tell me what you think below, and please like the video. Liking the video helps me out so much. I want about a 50% rate on the liking. Please. Thank you.